Hello, the topic of this discussion today, the presentation is what is a TIA and what can you do to try to prevent it from happening or to prevent a stroke. My name is Dr. Stanley Lang. I'm a medical doctor and sometimes known as the whole health doc. And the reason that I like to share about this subject today is because of actually two patients that I've seen in the last 2 days, both of whom had TIAs. So what does TIA stand for? It stands for transient ischemic attack. So what is a TIA? Well, actually, the definition is kind of shifting right now. So the original long-standing definition of a TIA was something that looked like a stroke, but went away within 24 hours. So there'd be some sort of a neurological deficit that looked exactly like somebody's having a stroke, except the symptoms would resolve within 24 hours. And the thinking at that time, and until very recently, was that there was a temporary blockage in one of the arteries, and that blockage got opened up by the body in time to save that part of the brain. Now, the reason the thinking is changing a little bit on this is because with more advanced MRI scanning, we can actually see that some people will actually have some brain damage with even 1 hour of blocked artery. And in some cases where there's a TIA, by the definition I just gave you, there's actually evidence of some brain damage in the region where the person had the deficit. So it's not as black and white as it used to be. And so we know that TIA doesn't equal no brain damage. In some cases, there actually was some brain damage, but there is so much recovery that the person can't tell that they've had some brain damage. And in fact, there are a lot of people who have had small strokes that they've never known that they've had it. We see it on an MRI scan, and there'll be evidence of having had multiple small strokes in the past. So a lot of times in the past, the TIA was called a mini stroke. Well, it wasn't really a mini stroke because there was no permanent damage as far as we could tell. Now, what I'd like to talk to you about briefly is some of the challenges in whether a person is having a TIA or not is that there are other things that can cause a temporary neurological deficit. First thing is seizures, which is something that most people have heard. I'm not going to go into detail of definition, just that seizures can cause that. And then something called a migraine aura. Now, everybody's heard of migraines, but an aura is a neurological deficit that happens before the headache starts. And in some people, they don't get the headache, they just get the aura. And the reason this happens is because of spasm of the arteries on the surface of the brain or in other places. And then the spasm opens back up, the symptom goes away. But when the symptom first starts, particularly if it's the first time the person's ever had an aura, it's very much like a TIA in some cases. And so sometimes a person just can't tell the difference. Although there's some clues by the history that points more towards an aura. I'm not going to go into detail now. The point is that other things can cause a TIA-like symptom, and syncope is a word that means fainting. So somebody can faint from a lot of different reasons besides a TIA, but a TIA could be also a cause of fainting. So the idea with the TIA, though, is that basically it looks like a stroke, and in the early stages, you can't tell if it's a TIA or it's a stroke because you don't know if the symptoms are going to go away in that 24-hour period of time. So a stroke or a TIA is considered a medical emergency. And if you're having symptoms that might be that, you just need to go immediately to the emergency room. If you're thinking, am I having a TIA when you're watching this video? That's the wrong thing to do. You should be heading to the emergency room. The purpose of this video is to help answer the question, what can we do to prevent TIAs and strokes? So the whole concept about this video is stroke prevention. What can we do to prevent these kind of things happening to us? And so I want to just share briefly with you, because of these two patients, very diverse backgrounds. One was doing about everything wrong you could do with your life. The other person wasn't doing anything wrong, and yet she had this TIA-like event. So these are the recognized major risk factors that we know we can do something about. BP stands for blood pressure, elevated blood pressure that's out of control, smoking, diabetes that's out of control, the diet that a person is following, inactivity, just sitting around is a risk factor. Lipids means the cholesterol profile. A lot of people think that the so-called bad cholesterol is the big risk for the lipids. It's actually not. It's a trivial, almost trivial risk factor for most people. But what is very evident on a lipid profile is the triglyceride HDL ratio. Triglycerides is a type of fat. HDL is the good cholesterol. And the ratio tells us a lot about a person's risk because of something I'm going to mention in just a moment. And then the last thing is atrial fibrillation, Afib. That's a heart rhythm abnormality. And if you've got that, by using a particular kind of blood thinner, you can decrease your risk of stroke substantially. It's not black and white there. There's some reasons some people wouldn't use a blood thinner, but the point is it's an option. And most of the time people with atrial fib, they're on a blood thinner to help prevent stroke. But there's two areas that are not talked about enough, and that's what the focus of this, that I want to end this this brief video on. These are things that are really the big players, I think, when it comes to stroke and to TIA. The first thing is insulin resistance. So what is insulin resistance? Well, basically, back on this little list of things that I said were correctable or controllable risk factors, where I said diabetes was one of the risk factors. Well, insulin resistance is the chemical process that's going on in your body that is underneath diabetes and precedes it by usually decades. And insulin resistance is where you've been eating in a way that gradually your body's own insulin becomes unable to do its job. So the body has to pump out more insulin to get the job done. And that biochemical resistance to the insulin is what we call insulin resistant syndrome, or sometimes called metabolic syndrome. Now, this has been recently shown to be the major risk factor for coronary artery disease. So coronary artery calcification is the major thing that correlates with having a heart attack. And insulin resistance is the thing that correlates most with coronary artery calcification, not cholesterol levels. So if you think that your cholesterol is great, but you don't have insulin resistance under control, you are aiming at the wrong target. And so, following a diet that reverses insulin resistance and exercise program is a critical part of decreasing your risk for having a heart attack. Well, what's that got to do with the TIA? Well, it turns out that all of the risk factors that have anything to do with any kind of vascular disease are all the same. So the heart attack is obviously the thing that we know most about because it happens more often than strokes and more often than TIAs. But it is, if you have risk factors for heart attack, you've got risk factors for stroke. So even though we haven't the research that proves the tight connection between insulin resistance and TIAs, I can guarantee you that that's a big player because it's tightly connected to having heart attacks. And it's easy, I should say, it's simple to fix insulin resistance. It may not be easy because it involves making some changes in your lifestyle. Now, if you have also significant stress on top of insulin resistance, this is like pouring oil on a fire. Now, stress by itself, if everything else is going on perfectly healthy, has much less of an impact on vascular disease. But it still has a major player. It still is a major player. Before the advent of having stents to open up coronary arteries in the 1980s, stress reduction was being pursued as the major thing that we could do to help prevent heart attacks and heart disease. But once this intervention became available, all that research just stopped. And we haven't done any research on stress reduction and heart disease since the 1980s, although we know that it helps. So stress plays a major role in amplifying all these other risk factors. And if you don't have stress and you have these risk factors, the risk is actually quite a bit lower. But unfortunately, most people in the United States are living with a lot of stress. So that is amplifying all of your risk factors. So finding a way to decrease stress in a way that really, really works is part of the solution to decreasing your risk for having a TIA and having a stroke. So if you have TIAs, the probability of having a stroke, which is permanent damage to the brain, is much, much higher to happen in the next weeks or months. So TIA is like a warning shot across the bow. And if you don't pay attention to it and you don't start changing things rapidly, your risk for stroke goes way, way up. So these are the two things that I think are the biggest things. The other things that I mentioned in that list, they're real, they're important, but these are often not paid attention to. Insulin resistance and stress reduction. Now, I'd like to give you a book that's going to teach you how to reverse insulin resistance. It's called Why Am I Still Fat? I'm also like to give you access to my online academy that you can get free access for 7 days just to test it out, that teaches everything you could possibly do for stress reduction, in addition to everything you can possibly do to decrease insulin resistance, plus a lot of other stuff that has to do with overall health, reducing risk for a lot of different chronic diseases. And you can access that link below this video and just click on it to get that 7-day free trial. So TIA, stroke, these are things that we can decrease the risk dramatically. We can't decrease the risk of any disease 100%, but we can decrease the risk dramatically. And these are things that you can do by following the strategies that are in these resources that I'm making available to you. So if this is an area of concern for you, I encourage you to take advantage of this opportunity. Click on the link. Have a good day and God bless.